Behind every health conversation is a story of challenges, discoveries, resilience, and the search for better solutions. Hello and welcome to Health Digest, your go-to program for timely, relevant, and people-focused conversations. I am Ukeme Etuknwa. Today we bring you stories and conversations shaping health and well-being, including important discussions on why investing in early childhood development, especially for children affected in conflict displacement and humanitarian crisis, is essential for Nigeria's future. On that note, let's begin with our health news.
We begin with a fresh development, where in a major move to boost Nigeria's drive towards achieving universal health coverage, the federal government has secured nearly $500 million in support from Gavi, the Vaccine Alliance, to strengthen immunization and primary health care over the next 5 years. The funding, approved under the Gavi 6.0 program, followed high-level talks between Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, and Gavi Chief Executive Officer, Dr. Sania Nishta, in Abuja. The minister says ongoing reforms in the health sector are already yielding results, revealing that quarterly visits to primary health care centers have increased from about 10 million in 2023 to over 45 million, reflecting improved access to quality health care.
We're a large country, and the fact that you are proposing almost $500 million over the next 5 years for Nigeria's vaccine effort, I think speaks volumes. For us, that is another impetus for us to do more with our domestic financing to ensure that we secure the vaccines, but also we ensure that they are delivered.
The funding will support routine immunization, sustain polio eradication efforts, expand human papillomavirus vaccination, and strengthen primary healthcare services across the country.
So these are the 5 objectives of our visit. To recap, number 1, to reaffirm our support. Number 2, to explain to you how your voices have really mattered, not just for Nigeria, but for the continent, and to go over the details of the country letter if you wish. Number 3, to assist you in overcoming any fiscal challenges in the spirit of partnership.
He also urged state governments to increase investment in healthcare and immunizations, stressing that stronger collaboration at all levels of government is essential to achieving universal health coverage and improving health outcomes for all Nigerians. Still on health news today, Kaduna State is stepping up investments in its healthcare sector as the government says its partnership with the Gates Foundation is delivering results in expanding access to quality health services, especially for vulnerable and underserved communities. Governor Uba Sani says the partnership, which stemmed from an agreement signed in New York last year, has helped fast-track healthcare reforms across the state. Speaking during a meeting with a delegation from the Gates Foundation, the governor disclosed that the state has recruited 1,500 healthcare workers under a 5-year plan to employ 1,800 personnel, describing the move as a major step towards addressing the shortage of health professionals.
Still ahead on Health Digest, some major health developments making headlines. Wearable Health Technology has developed far beyond counting steps. Devices such as smartwatches, smart rings, skin patches, and medical sensors can now monitor health indicators, including heart rate and abnormal heart rhythms, blood oxygen levels, sleep patterns, physical activity, and body temperature. Glucose levels in some specialized devices as well. The major innovation is a continuous monitoring and traditionally accepted method in which a doctor may measure a patient's blood pressure or heart rate only during hospital visits. Now, wearable technology can potentially collect health information throughout the day and identify unusual changes. In Africa, however, the affordability remained a significant issue. The greatest potential may therefore not only lie in expensive consumer smartwatches, but in the affordable medical sensor and remote monitoring devices designed specifically for low-resource settings. Next, it's Truth Lab, where we shed light on health topics that matter and separate health facts from the myths. Stay with us. Today's question is, can you eat your way to twins? The answer is no. There is no scientific evidence that it does. However, in a town called Igbo-Ora in Oyo State, often called the twin capital of the world, known to be a town with one of the highest rates of twin births anywhere. For generations, many residents have believed that regularly eating Ewedu, Lassa, and local white yams, as well as drinking the town's water, contribute to the unusually high number of twins. However, scientific research tells a different story. Studies have found no proven compound in Ewedu or okra leaves that causes a woman to release multiple eggs, which is what leads to fraternal twins. Instead, researchers believe the main reason lies in genetics. Many women in the Yoruba population, especially around Igbo-Ora, appear to have an inherited tendency to hyperovulate, meaning they naturally release more than one egg during ovulation. When both eggs are fertilized, fraternal twins are then conceived. So while Ewedu is a healthy vegetable packed with fiber, vitamins, and antioxidants, there is currently no scientific proof that it causes twin pregnancies. The remarkable number of twins in Igbo-Ora is best explained by hereditary factors rather than diet. Experts say the first 5 years of a child's life represent the most critical period of brain development. Now, according to child development specialists, quality nutrition, healthcare, responsive caregiving, protection, and early learning opportunities during these formative years significantly influences a child's health, education, and productivity later in life. Stakeholders are therefore calling for stronger policies and increased investment in early childhood development across Nigeria. If you love our news and updates, stay connected with our space through our social media platforms. We're Ukeme on air on Instagram, YouTube, and of course on LinkedIn. Coming up next is Nature's Healers before we round up. We're going to be exploring foods and nutrients that support the body and contribute overall to your well-being. Let's break it down. Today, we're exploring Aiden fruit, scientifically known as Tetraplora tetrapreta. Native to West Africa, this dark brown aromatic fruit pod is popularly known as Aridan among the Yoruba people and goes by different names in other communities. For centuries, Aiden fruit has been valued not only for its instinctive flavors, but also for its role in traditional healing. Different parts of the plant, including the fruit pod, bark, and leaves, have been used to help relieve digestive comfort, support women during postpartum recovery, reduce inflammation, manage fever, and improve general body strength. Researchers have identified several natural compounds in Aiden fruit, including flavonoids, tannin, saponins, and other antioxidants. Laboratory and animal studies suggest these compounds may have antioxidants, antimicrobial, anti-inflammatory, and blood sugar-related properties. Aiden fruit is also naturally fragrant, just as one small piece of the dried pod can flavor an entire pod of its soup, making it one of West Africa's most aromatic traditional spices. Nature has long provided ingredients that flourish both our bodies and our cultures. Aiden fruit is a perfect example of how traditional knowledge and modern science can come together. But it's always too important to remember that traditional remedies should complement and not replace professional. Thank you for staying tuned to Health Digest. Yes, so it is our time for the expert chart on Health Digest. We're going to be looking at an interesting topic in light of recent events. As we must know by now, the children that were kidnapped from their various, educational centers in Oyo have been rescued. However, the lasting psychosocial effects are an area in which that we don't speak about, and this is a cause for us to pay greater attention to our mental health. So today we're going to be discussing early development, trauma, and so much more. And to give us insights on this conversation, we're going to be having Mojid Alabi, who is the co-chair coordinator of the REACH network, which is a part of the Moving Minds Alliance convergence of organizations, CSOs that come together to ensure that children have, good early development, especially when it comes to crisis. I'll also be speaking with Peter Fojino, who is the Educational Technical Advisor for Save the Children, and we're going to be discussing early childhood development and crisis when it comes to their development. Hi, good afternoon, gentlemen. Thank you for joining us.
Good afternoon.
Good afternoon. How are you doing, Mojid, and how are you doing, Mr. Peter, this beautiful afternoon?
Good afternoon. Good afternoon. Very happy being with you this afternoon, and it's a pleasure.
Absolutely amazing.
Good afternoon, viewers. Yeah.
Absolutely amazing. So I met you guys during a convergence for like minds, especially those in the journalistic areas when it comes to early childhood development. I'd like to get a quick take on the importance of early childhood development in crisis management. First from Save the Children with Mr. Peter, and then I'll take Mr. Mojid's view on this. Please go ahead.
All right. Thank you very much for this very wonderful topic. The topic that should be talked over in recent times because of how critical this topic is. Early childhood development actually matters a whole lot in crisis contexts, knowing fully that in crisis contexts, children are the most affected. And when it comes to the development of a child, especially in crisis, the child usually missed out on a number of things. What are we talking about? We're talking about access to nutrition, access to learning opportunities, and access to health. And as you are aware, as you know, rather, I would say for every child, nearly 90% of the child's brain develop within the first 5 years. The first 1,000 days is very critical for every child. And for every child to develop to reach its full potential, it is expected that the child have access to health and nutrition, where the child is able to develop. And then beyond just health and nutrition, we're also talking about access to learning opportunity, where the child is able to interact and have some kind of engagement so that the future becomes even brighter for him. Thank you.
Thank you so much for that, Peter. I'd like to get your take, Mr. Mojid, on this. What exactly is early childhood development in the area of crisis management to the REACH network? Let's hear from you, Mr. Alabi.
Yeah, thank you very much. Am I audible?
Yes, I can hear you very well. Yeah. Thank you.
Thank you so much. From the perspective of REACH network, REACH network, by what it means, is reporters for early childhood development in crisis.
Yes.
And what we think of is that beyond just reporting general issues, the matter of children should be taken to the front burner. And how do you do that? Is by actually understanding why early childhood development is critical. We have been told that from age 0 to 5, that is when the brain of a child is formed. So for every child, who is disadvantaged, either as a result of crisis, either as a result of war, flooding, communal clashes, banditry, or whatever, any form of crisis, you understand that we hardly get their matters relegated to the background. And what is important at this level is that when people discuss, we hardly take the case of children serious. And that is what we feel that journalists should now come up with ways and manner to actually raise the bar in terms of how do we report about issues of children, of these children, especially those in crisis, to gain attention. And more importantly is the fact that when crises happen, these are the major victims because they are dependent. They rely on helpers to survive. But, you know, most times they are the first set of victims who will have to depend on people before they can escape the challenges. A mother will have to first of all be taken care of before a mother can breastfeed. So these are the kind of challenges that we have identified, and we feel that when reporting, reporters must be deliberate about raising these fundamental issues, whether it's about nutrition, whether it's about their welfare, whether it's about their health care, whether it's about their safety. These are very important issues. And you could see what happened in Orire, the last kidnap abduction that happened. A child, just because the condition was very terrible for that child in captivity, the child had to give up. And you could see those children who were filmed when released. You will notice that some of them look very, very unkempt. They look very, very emaciated. These are issues and very challenging things that we think we must consider as reporters in a way that people will be able to understand that this is a very, very significant issue that require attention. So when it goes to learning also, there are specific things that must be in place for them to actually achieve proper learning. These are things that we are calling attention that journalists within the Reach Network should be able to call attention to.
Thank you so much for those insights. Quite insightful there. I mean, there's reporting from a holistic perspective, there's reporting from particular angles, but we don't necessarily see the child's perspective, especially in light of recent events with the school kids kidnapped from Oyo. We've seen a lot of story and updates from their kidnapping to the rescue efforts and them being, reunited with their families. But I'd like to understand, you said, the development of a child goes from 0 to 5 years old, and a lot of these children are between that age. What are some of the things that we should be focusing on first? I'd like to get the perspective from the educational technical advisor. What are some things that we should be looking at when it comes to these children that have just been reunited? And when it comes to the Reach Network, I'd like to understand, how should this story be told to ensure that the main victims in this story, which are the children, are given the right spotlight and are given the right attention for some of these categories of things you've mentioned, nutrition, health, education, and everything else to be put in perspective? So I'd take your take, Mr. Peter, and then I'd hear from you, Mr. Alabi. Thank you.
All right, thank you very much. So like also Mr. Alabi had mentioned, one of the things that could be missing out, especially for these children, is the fact that when children are caught up in any form of crisis, be it kidnapping or whatever, you will agree with me that most of these children are denied quality feeding. And for that purpose, you would realize that the nutritional value that any child could have is missing out. And that forms part of what is very essential for a child to develop. Now, beyond just even the Orire crisis, if you look at, especially in other crisis contexts, especially in the Northeast or in the Northwest, you would realize that whenever displacement as a result of these factors, children get to miss out from all of these very critical elements. And we'll talk about, like, for example, malnutrition. You are talking about a child who is not being able to feed and get the necessary requirement for the brain to develop. You would experience that a lot of children are having stunted growth, where you see a child who is about 11 years looking like a child of 6 years. You see, these are effects of malnutrition. We are expected to see that a child should be able to grow according to the age that he is supposed to. So as a critical factor, children should be prioritized irrespective of what situation they might have found themselves. You would agree, like Mojit also mentioned, that when children are caught up in crisis situation, those moments becomes naturally it's not their fault to find themselves in such a situation, because the child eventually grows to take decisions for himself and for the community in the future.
So I'd like to, sorry, not to cut you short, but I'd like to know, in regards to recent events with the children currently being released, in regards to the incident in Oyo, what should be the first line of action for the children? Should it be to be reunited with their guardians? Should it be medical attention? What exactly should be the first line of action to save the children?
All right, so thank you very much for that wonderful question. I think other provisions comes in. Are we talking about the feeding? That is very, very critical. You would observe that most of the children were quite malnourished, spending those number of days in the bush. They were quite malnourished, and then it is important for us to, in the next 30 days, to focus so much on their feeding, to ensure that they have nutritional food, so that their body, whatever that has been lost in terms of their development, in terms of their growth, in terms of their well-being.
Thank you so much for that. And I really love the last point that you brought it on the psychosocial support, because, when we speak of reintegration, a lot of times we do not focus on the importance of that, and I'll circle right back on that. Now, I'd like to hear from Mr. Mojid on the reach approach to this. How should journalists be covering this from a child-centered point of view?
Yeah, thank you very much. Like he has explained, the psychosocial aspect of their welfare is quite important.
Yes.
We will expect that we keep monitoring these kids. Why not? Why also observing their safety, also observing their integrity. Why not also stepping beyond the ethical band? It is very important for us to actually keep monitoring this, because you do not know, within the next 1, 2, 3 years, we may see some of these children who may just be waking up in the middle of the night out of fear. Some of them may be nurturing some fear and unable to do certain things. These are quite important. I think the most important for journalists at this time is not just for sensationalism, not just to get headlines, not just to talk about numbers, but also to think about what becomes of these children at this time. It is important for us to have journalists who are going to be following up on them in terms of monitoring their welfare. Are they able to go to school? Are they able to learn in school? Who is taking after them? Where are they kept? These are things that, because coming from this kind of shock, some of them may not recover so quickly. Getting acclimatized to the normal system may take some time. So it is important that their care is giving proper monitoring. You said not all the time that you put everything to paper. Journalists are meant to also observe. Journalists are meant to follow up. Journalists are meant to ask critical questions There are times that maybe some of them, out of probably fear, they may be not, they may be exhibiting some kind of attitude which their caregivers may not understand. But if we are actually following up on them, you could ask relevant questions and be able to bring out certain matters to the attention of relevant individuals or authorities. For instance, maybe they have appointments in clinics, their caregiver may not have the opportunity, but when journalists are deliberate about following up on them, it will be very, very easy for stakeholders to really understand why the care is important.
That's
Thank
correct.
You very much.
Thank you so much, gentlemen, for your time. This is a developing conversation, so we'll definitely pick this up another time. Thank you so much again for discussing early childhood development in crisis management in the country. Thank you so much again. And that's our program today. From health awareness and expert conversations to global health development and community impacts, we've explored key issues shaping health across different spaces. Thank you so much for staying with us on Health Digest. As always, you need to stay blessed and not stressed. I'm Ukeme Etuknwa. Bye-bye for now.